So let me also ask you, when President Trump said last weekend that insurance was going to be much better, do you think that insurance without protections for those pre-existing conditions, or without maternity coverage, or without mental health coverage, or insurance that would reinstate caps on cancer treatments is better?
Well, I don't know that that's what he was referring to. I think
We said it would be better, and if we in fact took away, if we went to high-risk pools instead of covering people with pre-existing conditions, or if we stopped the other coverage we have now, I'm just wondering if you define that as better.
well, I mean, you'd have to give me a specific
Well, let me give you an
What's
example.
better for
Do you
you
think-
may not be better for me or somebody else, and that's the important thing that I'm trying to get across, and that is that patients need to be at the center of this, not government. Should government be deciding these things, or should patients be deciding these things?
Prior to the Affordable Care Act, about 70% of the private plans that a woman could purchase in the marketplace did not cover basic maternity care. Do you think that that's better, not to cover basic maternity care?
Then I presume that she wouldn't purchase that coverage if she needed it then.
She would have to pay more, just as in general, for many women, just being a woman was a pre-existing condition. That is the reason why we have a basic set of services covered under health care. So it's just a different way of looking at this. This is something where, sure, if a woman wanted to pay a premium, wanted to pay more, she could find maternity care. We said in the Affordable Care Act, that's pretty basic. And for over half the population who are women, maternity care ought to be covered. Let me go to another one. Do you believe that mental health services should be a guaranteed benefit in all health insurance plans?
I've been a supporter of mental health parity inclusion, yes.
So mental health should be a defined benefit under health insurance plans.
I think that mental health illnesses ought to be treated on the same model as other physical illnesses.